Hello everyone. Today we will go step by step learning about how to take the history in an antenatal patient. So in history, first thing that we ask for the LMP of the patient. LMP is the last menstrual period and the first day of the LMP must be inquired about to all the patients visiting an antenatal clinic. LMP helps in calculating the gestational age as well as the EDD or the estimated delivery date. Now, for gestational age, it is equal to the period of pregnancy or equal to the period of amenorrhea, and it is calculated from the first day of the LMP. So, if the cycles are regular, we can calculate it easily as ovulation is occurring on the 14th day. Fertilization is presumed to occur on the 14th day as the lifespan of secondary oocyte is 12 to 24 hours. So, this line diagram depicts first day of LMP, day of fertilization or ovulation, and the day of missed period. That is, in a 28-day cycle, this is the missed period, and the span is 2 weeks after fertilization till missed period. And if the period is missed, and when you check for the UPT, if it is positive, then we tell according to gestational age, calculating from the day of LMP, the patient is 4 weeks pregnant, and from the day of fertilization, she is 2 weeks pregnant. So this is the fetal age and this is the gestational age. If a patient presents with a history of missed periods and UPT positive, she is 4 weeks pregnant, fertilization has occurred 2 weeks back. There is gap of 2 weeks between the time of fertilization and the gestational age. It is gestational age equals fetal age plus 2 weeks. Fetal age is calculated from the day of fertilization. A gestational age of 36 weeks 6 days means 36 weeks 6 days, and if we want to calculate the fetal age, then fetal age is 34 weeks 6 days. Fetal urine production begins by 12 weeks as we have already discussed, and 12 weeks is calculated from the first day of LMP. Now, for duration of pregnancy, the total duration of pregnancy we all know is 280 days or 40 weeks or 9 months 7 days or the 10 lunar months. For term delivery is occurring as we all know that 37 weeks is the term pregnancy, 37 weeks till 41 weeks 6 days, and less than 37 weeks is preterm labor. If delivery is occurring before 37 weeks, it is preterm labor. 37 weeks to 39 weeks, it is early term. Full term is 39 to 40 weeks 6 days. Late term is 41 to 40 weeks 6 days, and post-dated is more than 42 weeks or 294 days. Now there are two definitions, which is an abortion. What is an abortion and what is IUD? So abortion is a pregnancy loss that occurs at less than 20 weeks of gestation, while IUD occurs when the pregnancy loss is occurring after 20 weeks of gestation. Now there is one rule known as the Niggles rule, which is used to calculate the estimated date of delivery, in which we ask the patient about the first day of LMP, and then we add 9 months and 7 days. We can either add it in a forward manner, or if we calculate backwards, then we can minus 3 months also. So Niggles rules assumes, so this rule implies in those patients who are having regular cycles of 28 days, patient is not on any OCP and the patient is not lactating. So the first day of LMP is beyond 22nd day of any month. 7 days must be added first before 9 months. For example, a patient gives an LMP of 20 February 2022. So we will add, either we will subtract 3 months. So if we subtract 3 months, then the month comes is November, and then we add 7 days. So 7 days. So 7 days if we add, then it will become 27th of November. So the EDD is 27th of November, or either we can calculate it forwards like Feb to March, April, May, June, July, August, September, October, November. So 9 months means November, and 7 days we add in 20, then it will become 27th November 2022. Sorry. A lady gives history of having her period on June 26, 2021. She had bleeding till 4th day of July. So she had bleeding till 4th of July. She missed her period in August 2021. UPT was done, which came out to be positive. So she had a period on 26th June. So the LMP is 26th June. Now to calculate the EDD, we will try to subtract 3 months from June. So May, April and June. June, May, April. So 3 months means it will be March. And if we add 7 days in this, then the date will become 2nd. So the EDD is 2nd of April 2022. Let's check whether we have done it right or not. Yes, so either 3rd or 2nd of April is the. So the EDD is 3rd of April 2022. Add 7 days first, then 9 months. Only 4% of women deliver on exact EDD. So the estimated date of delivery, the delivery rate is just 4%, and 50% women can deliver 1 week or after the EDD. So what is corrected EDD? So in a patient with regular cycles, we can apply Nigri's rule. But if the LMP is either short cycle or longer cycles, like cycle length of less than 28 days, example 26 days, if the cycles is shorter, the difference between the cycle length and 28 is subtracted from the rough EDD. So to calculate the corrected EDD, we will try to subtract 2 days from this rough EDD, and if cycles are longer, that is more than 28 days, when we will try to add those days. If EDD is calculated using Nigri's rule only. Patient gives LMP history of 20 Feb 2022 and a cycle length of 35 days. So how many number of days are extra? 7 days are extra. And if we calculate the rough EDD, it is coming out to be 27th November, and then we add 7 in this, then we get 4 December. So the corrected EDD is 4th of December. Now Nigri's rule is not a reliable method for calculating EDD. In what patients? In patients who is on OCP. As we have already discussed, irregular cycles, unknown LMP means a lactating female, or if the height of the uterus on physical examination is not corresponding to the period of gestation. So in these patients means a patient on OCP has conceived either irregular cycles, lactating women, and there is disparity between height and physical examination corresponding to LMP. So we will try to calculate it through USG, and USG is the best method to calculate gestational age in such cases. The best time to perform USG is the first trimester. And what parameter we will use for first trimester? It will be crown rump length, or the CRL. The best parameter to calculate gestational age is CRL, and it is measured in the first trimester itself. Now there are other important history taking that we ask the pregnant women, whether the pregnancy is a natural conception or an induced conception or through IVF. How the pregnancy was confirmed? Either was confirmed by USG or UPT or beta HCG levels. If UPT has confirmed, then this is a clinical method of confirmation. USG means radiologically confirmed, or beta HCG means biochemically confirmed pregnancy. So if the pregnancy has been attained by IVF, it could be a fresh IVF cycle or an IVF cycle through frozen embryos. So how will you calculate the EDD in such patients? So for fresh IVF cycle and for frozen embryo, the thing is different. In IVF, the secondary oocyte taken from the female partner in a fresh IVF cycle means at the day of retrieval, and the sperm are kept in the petri dish for fertilization to occur. The embryo is transferred back into the uterus on the day 3 or day 5 of fertilization. So the day of oocyte retrieval is the day of fertilization. First day of LMP is equal to the day of oocyte retrieval minus 13 days. So EDD first day of LMP to EDD, it will remain the same. Or we can add EDD is equal to day of retrieval plus 266 days. But if it is done with fresh embryos, then day of egg retrieval will not be equal to day of fertilization. So if there is day 3 transfer or day 5 transfer. If the transfer is done on day 3, then the embryo was transferred on day 17 of the cycle. Means first day of LMP is equal to day of transfer minus 16 days. This you have to cram. day of transfer minus 16 days, and in day 5 transfer we have to add more days, means day of transfer minus 18 days. EDD is calculated by the Nichols formula, or day of transfer plus 263 days, and in this day of transfer plus 261 days. Now there is one obstetric score also known as the gravida parity score. What is gravida? Gravida is a female who has conceived, so it is the total number of conception, means number of time a woman has conceived irrespective of the outcome, be it an abortion or a live birth or an IUD. So it includes present pregnancy also. While parity is the period is the number of previous pregnancies which have gone beyond the period of viability. Present pregnancy is not included in parity, and twin and triplets are counted as one as they are the result of single conception. So gravida is included in present pregnancy, while parity is not included in present pregnancy. All pregnancy irrespective of the outcome is considered as gravida. Outcomes be like So what is the period of viability? Period of viability is the period beyond which the fetus is capable of independent existence. In developed countries it is 20 weeks, but in India it is just 28 weeks because we lack many facilities not available at our setup. So GPAL system or GTPAL system, initially we use the GPAL system, but now we are using GTPAL system. G for gravida, P for parity, A for abortion, and L for live birth. So gravida, we all know what is gravida. Parity is the pregnancies which have crossed the period of viability, that is more than 28 weeks, and not included in the present pregnancy. Abortion include all pregnancy losses which occurs at a gestational age of less than 20 weeks. Ectopic and molar pregnancy are also counted as abortions. While living children at present, twins and triplets are counted as 2 or 3 respectively. What is T? T is the term delivery. So number of pregnancies, number of previous term deliveries, if the deliveries occurred between 37 weeks to 42 weeks, then this is a T, and P is for the number of previous preterm pregnancies. So here T and P are different, unlike GPAL system. T for number of previous term pregnancies, and P for number of previous preterm pregnancies. Rest all is same. In GPAL system, a pregnancy between 20 to 28 weeks could not be included in any of components, and hence is not used. So can you see this? So the parity includes 20 to 37 weeks of pregnancy and 37 to 42 in T. But in GPAL system, 20 to 28 weeks is not included, hence we no longer use GPAL system, we only use GTPAL system. Now, coming to the confirmation of pregnancy. The pregnancy can be confirmed by detecting HCG in urine or blood. So, if you are detecting beta HCG in urine, it is a qualitative test, while serum pregnancy test, which detects the beta HCG in the blood, can be quantitative test or qualitative test. Quantitative tests are more commonly used, and it includes the fluorescent assay and the radioimmunoassay. Or it can be confirmed by USG also. So what are the serum pregnancy tests? What is the difference between serum pregnancy test and the urine pregnancy test? Serum pregnancy test detects pregnancy earliest by 8 days after fertilization, means at around day 24. So it can detect pregnancy at around day 8 of fertilization, while UPT detects pregnancy as early as the day of the missed period. So what is more sensitive? If it is detecting pregnancy 4 days earlier, then serum pregnancy test is more sensitive and UPT is less sensitive. Minimum HCG levels for a positive test in serum pregnancy test for qualitative assessment, it is 5 to 10 milli-international unit per ml, and for quantitative 1 to 2 milli-international unit per ml. Minimum HCG levels for a positive test for UPT is at least 20 to 50 milli-international unit per ml. And it is a qualitative test. Negative serum pregnancy test means HCG less than 5 milli-international unit per ml, and if the UPT is negative on the day of missed period, it must be repeated after a week. So if UPT is negative on the day of missed period, it must be repeated after a week. So what are the causes of false negative test and the false positive test? Causes of false negative test means pregnancy is there but the test is negative, means the test might be performed too early, or the hook इफेक्ट. इफ द लेवल्स आर एससीजी आर वेरी हाई, जैसे कि न्यूप्लेजिया में होते हैं, देयर कुड बी अ फॉल्स नेगेटिव रिजल्ट. सो टू कंडीशंस वेयर फॉल्स नेगेटिविटी कैन बी देयर, और अर्ली टेस्ट परफॉर्म्ड, और हुक्ड इफेक्ट. Now there are causes where we see a false positive test, means pregnancy is not there but test is getting positive. So observer's interpretation, he might have interpreted a weakly positive line into a positive test. SCG producing tumors, so SCG producing neoplasias can detect false negative as well as false positive. So SCG secreting tumors, exogenous SCG was given to the patient like HCG injections, and chemical pregnancy means pregnancy has terminated immediately after implantation. In those cases also test is weakly positive but the pregnancy is not there, means early pregnancy failure. Now the antenatal history, we have talked about LMP, date period of gestational calculation, and gravita parity, GT pal system, UPT, urine pregnancy test, whether done by biochemical methods or the radiological methods or the physical methods, and calculation of EDD. We have already discussed duration of pregnancy. Now we also take a diet history, drug exposure history, radiation exposure history, and substance abuse history in antenatal history also.